How will you know if your tube is blocked? The tube will be stiff to flush. You are unable to flush water through the tube. The ends of the Y connectors are pushed out of the tube when feeding or flushing the tube. The most common cause of tube blockage is not flushing the tube with water immediately after feed or medicines. Always follow the advice on flushing your tube. Never use cola or fruit juice to unblock your tube. They can react with feed or medicines and make blockages worse. The following may help to unblock the tube. Attach an empty 60ml syringe to the end of your feeding tube. Pull and push the plunger backwards and forwards to create some pressure. Fill a 60ml syringe with hot but not boiling water, soda water or bicarbonate of soda, and flush into the feeding tube. If using bicarbonate of soda, dissolve 2 teaspoons into 50 ml of hot, not boiling water. If this does not work and you can see the blockage, use a wet cloth or flannel with hot but not boiling water and wrap around your feeding tube. Squeeze the feeding tube between your finger and thumb to help soften the blockage. If this works, flush the feeding tube with 60 ml of water. If this does not work and you feel confident, place a towel or bowl under the tube. Open the ports of the Y connector. Squeeze the tube between your thumb and finger, massaging or milking the blockage down the tube until it comes out. Flush your tube with cool boiled water. If you have followed each step and are still unable to unblock your tube, contact your community home enteral feeding dietitian or 24-hour feeding company helpline or your district nurse for advice. If you have any problems with your PEG site, please contact your feeding company nurse, GP, M&D nurse or district nurse. If the tube falls out, you should have a spare tube at home. If your tube comes out before it has been placed for 6 weeks, take your spare tube with you to hospital. If your tube comes out after it has been placed in for longer than 6 weeks, you can use your spare tube. Open the bag and take out the tube. Open the lubricating jelly and put it on the end of the tube. There are centimetre markings on the tube. Hold the tube close to the end and push it into the tract. Push the tube in to 6 centimetres. There is a 10 ml syringe filled with sterile water in the pack. On the tube there are 2 ports, one clear and one coloured. Put the syringe into the coloured port and plunge 5 ml of water. Contact your feeding company nurse or district nurse before using your tube. Do not use the tube until you have been advised to do so.